Good afternoon, everybody. I'm here only to just give a small speech. As every second Thursday of September, it's the International Day of MPNs. We wanted to take advantage of it to have a hold a special webinar, something different from what we usually do. And we have the great fortune of having Natalia Curto, doctor. She works in London in the Harrison clinic, and she has a lot of experience in MPNs. I'm a person who has been over 35 years living with polycythemia vera. And if I think about how this world was 35 years ago and now, well, before it was a dark hole, we had hydroxyurea and the old interferon, and there was nothing else. Aspirin and very little knowledge. There was no information for the patients. If we look at what's happening nowadays, there's new things. We know JAK2 since 2005. We have cytoreductor um, medicines, which uh, uh, reduce the mutations that we have in the genes. Now we are looking for new paths with new products such as Pepsilin and many products that will help us a lot. Uh, we can think in a very positive way, and there have never been so many um, pharmaceutical companies researching on it, researching on the symptoms, not only the sickness. And we have never had this, so I'm very happy that we have such great work in the last years, also because of insisting on the industry so they think more about the symptoms that we have. We have many things that have not been covered yet, many products, many treatments, but it's very important that they help us with the symptoms. We are all suffering a lot because of the different symptoms such as tiredness, and there's many more. All of us are living a different kind of hell just to keep going every day. So I see a very big change also on the law and the industry field. It's not only going to the doctor and seeing the blood test and seeing the numbers and saying it's okay, come in 3 months. It's also about the doctor asking you, how are you feeling? What's your pain? What's having an influence in your life? And now we are at a more serious moment. So what I will ask is that there's so many of us in the different groups. It's not only in Spain and Switzerland where I usually work, and it's also about asking the patients to be more active in the groups. We need everybody's cooperation. Each patient's voice and opinion is important. I will stop here. I think we have a very happy day ahead of us, and that we can be very positive for the future. And having people such as the Dr. Natalia Curto, I feel very comfortable. Welcome, Natalia. Thank you, Peter. I'm so happy to be here. I give you the floor, Ingrid. Okay. Natalia, as always, will speak about one of the topics that I'm most passionate about. It's very beautiful to talk about this because very often, even you have mentioned Yeah, I'm trying to control the screen. Sometimes you've commented on it that you have been uh, appreciating the impact of the supplements on MPNs and the importance it has. It's a topic that you've already worked on every day with your patients. But on the other hand, all the patients that we have been talking with in Spain or other countries, it's not really the same thing. About supplements, usually people think it's not very necessary or it's not really appreciated. And I think it's very important to start talking about these topics because our immune system can fall quite easily very often because the supplements are not given. This also means that each type of MPN has different supplements that can work or cannot work. Again, I want to thank you because I know it's also an important day for you in your area. I know you've already been talking about it. So let's start talking about the supplements in MPNs. So go ahead. We're all very interested in this. Thank you. Thank you. I'm so happy to be here. We've been talking about this in other moments. Yeah. I want uh, I want to tell you that sometimes you might find a problem. I am sorry on the slides. I will talk about the supplements and the meal proliferative syndromes. When Ingrid and I talk about this topic, we started uh, looking for information, and there's not so much about specific information for these supplements in MPNs. So this makes us have many questions. So many products of these, as we will talk later, and also we will answer your questions. These are supplements that can help one of the symptoms, for example. We cannot put all of our burden on the MPN, so we need more research. This is the main thing I will say, and I will repeat over and over. But we need a lot of research on the topic, not only research about nutrition, but also about other things we need to work on. For example, exercise, meditation. These are supplements that generally help the person. It's not only that you have an MPN or not, it's that with all of this uh, base and the big boom that we've had in the last years, many people have been taking supplements because they help the immune system. They can help the bones, the muscles, all of this. You need to take it with a pinch of salt when we're talking about people with MPNs. We're all different on this regard. Different treatments can have a different impact. I will try to talk about the most important supplements or the ones that we've been using the most and the ones I've seen the most with patients or I've heard about. I also want to tell you that maybe I don't have enough scientific research and data because there's not really so much. As Peter has been saying with his experience in the last years, I've seen in the last 10 years, there's been a change. It takes some time, but there's been a change on the mentality towards having new supplements. So, with this kind of preliminary um, information, some very important things. Point number one, every time a person starts with a new medicine or supplement or some new herb, sorry for the light, you will see me jumping every now and then for the light. If you start taking herbs or teas or whatever, the most important thing is asking your doctor and the pharmaceuticals, because there's many things you can search for online, but also you need to speak with a doctor. I also need to know if my patient has been taking some supplements, maybe that has an impact on the blood tests. So you need to speak to your health provider. So each one of us is different. Maybe my body is not the same as yours and the other way around. So you need to have this into account. The dose is not going to be the same. Also, if you're taking some medicine that can have an interaction with these supplements, we need to have all of this and take this into account. And for lastly, these are supplements. It will not substitute hydroxyurea, interferon, ruxolitinib. It will not substitute it. It will maybe help with some symptoms, and you need to speak with your doctors about this, just to be sure that there will be no problems. So this one is a paper, an article. I Many of you might know Robert Mess, the doctor, because he's one of the most important persons in the MPN world, and also Robin, uh, known about her. And they had some research about yoga impact on MPN patients. So this research has a lot of patients. It's 1,300 patients. It's a lot, and with a distribution which is quite equal among the different MPNs, a bit of MF and PV. So these were kind of um, uh, in questions. We saw that most people who took supplements were women, and we should research on this, but maybe we should leave this for another seminar. And another thing that they found out is that most of them were around 60 years old. Many women, for example, on perimenopause or menopause, with an IMC which was lower, and were like having an physical activity. So maybe if you're working out, you already think about taking supplements. And then curiously, we can see the list of the supplements that are the most important. One of them is vitamin C. We'll talk about it more specifically. There were others such as multivitamin, magnesium, calcium, vitamin B12, herbal teas, for example, that can be very uh, there can be a lot of variety, some zinc, vitamin E. For example, in everyday life, I hear about these supplements, and with Ingrid, we realize that if people are asking about this, it means that people are using it. So for example, in Spain, some of these are not really that used. This is variety. This study, for example, comes from the US. So having a look at this, I couldn't see other things, but in MPN, this is like a big study. It would be nice to see if they have been researching about more about this, and if they have seen the link on um, symptoms. So the supplements I will talk about will be vitamin C, D, B12, magnesium, ginger. We'll also talk about iron and MPNs. We'll also talk about creatine, and we'll also talk about the detox diets. And many of you already know about this. And vitamin C is already known for helping the immune system. Every winter we should be eating oranges, but it can also help with um, antioxidation features, collagen, and other effects. For example, it's being used in cosmetics right now. Vitamin D, it's also very known. It's mainly recommended on women on menopause because it helps the bone health. Many people take it uh, on a preventive basis for the immune system, but it has other effects. Some studies are researching about vitamin D helping preventing other kinds of cancer. It can also help on the intestinal health. Then vitamin B12, it's also widely known. It's essential for the nervous system and red blood cells. And patients with myelofibrosis, it's common to have a lack of B12 vitamin because maybe they have the spleen so big, maybe you don't eat in the same way, and there's a deficit of an absorption. If, well, let's say that vitamin C right now with the diets we have, it's not really common to have a lack of vitamin C. Some years ago, maybe it was more common. For vitamin D, on the other hand, I work in London, for example, so there's no sun here. But it's also true that we see more vitamin D deficit, that 30% of population in countries even like Spain have a lack of vitamin D, which is curious because you see that you need to stay most of the time in the office. So yeah, here inside you will not take vitamin D. Another problem that we have more and more is that we use a lot of sunscreen, which we need to use, but there's this balance of either not taking, not sunbathing so much, mainly when we are MPN patients, because we need to protect ourselves. But then there's a deficit on vitamin D, and this can produce fatigue and bone uh, issues. This can contribute to that we already have. So I'm already used to giving from patients who feel a lot of fatigue and bone pain. I also ask blood tests.
Which are the resources for vitamin C, fruits, vegetables, and all those. But in space, we're lucky that we have very good oranges. These are very important. We'll speak later about it in the diet. You can take it medically. There are normally not such many interactions, but you need to bear in mind that there are some formulas that are brought with iron, and we need to be very careful with specific patients. We'll talk about it later. So you can take those pills in different sizes. You can buy them no matter where in a lot of places. For vitamin D, we can find it in a lot of milk resources, in a lot of fish dishes, and but when we're lacking a lot of vitamin D, we do need to follow a treatment. And normally is to get a higher doses and then a much higher doses at first, and then we reduce this dose permanently. And the perfect thing will be a supplement of 100 grams. Those are these are This is the measurement that we should take in our normal diet. Here in UK, we can take this supplement. We can buy it in pharmacies, herbs shops, and these are very little uh, doses, and it is very recommended to take it in winter time or whenever we're more prone to get a cold. And then if we move on to vitamin B12, I'm sorry if it doesn't see properly. Is the thing is that we have a lot of patients that absorb more iron than they should, and we need to bear in mind also that there are a lot of patients that they do not tolerate lactose and milk products. So we need to be careful that each person needs to follow a different diet. Maybe a vegetarian person and also a vegan one, you may need a B12 vitamin and supplement because you're not getting this source from the diet. And it is very important that we talked with the doctor because the diet plays a very important role in order to get all these sources. And then we move on to magnesiums. Ingrid, if you want to ask anything, yeah, I wanted to make a comment. We have a shot, honey, then you add ginger, cut in lemon as well, also cut it, or even orange, and then you put this inside the fridge so that it gets all together during 24 hours. And when you take this mix during autumn or winter, it helps you to have all your defenses very high, and you have all the supplements that you need, and also get a little bit of sun, go for a walk at first time of the day around before 10 a.m. and after 8 p.m. Obviously, not in August, but we need to play with our different options so that we can get a little bit of sun, but not get burned. Yeah, exactly. Ginger is very important as well, and we'll talk about it later. They are basics aspects nowadays. I- In English, you say turmeric, but we're talking about curcuma. Yeah, I wanted to highlight red pepper has way too much vitamin rather than other foods. And these are different products that you can eat during the day, and it's very easy to do it. Yeah, you're right. Globalization has let us do this. We have every type of foods, fruits and vegetables during all year seasons, and we absorb different vitamins when we take it in a diet. The combination between different fruits with ginger, we absorb better these vitamins rather than if we took them without ginger. And also, we can also take ginger um, in. We can take the ginger in also as if it was powdered ginger, and you can mix it with your orange juice. But this can go. It depends on what do we like better, and we need to try our best doing everything with common sense. We are not gonna go for a walk in Sevilla with 40 degrees at 3 p.m. We need to play with our different options and take the most out of them. If we always put on sunscreen, we're not going to absorb this sun that we need. And Peter also said it before. Uh, Patients need to be aware of everything so that they can talk properly with their doctor. Because in the end, the doctor has 20 patients and you just see the different doses. But if the patient asks you anything or speaks better with you about supplements, you don't need to just talk with the hematologist. You also have your family doctor. I got this diagnosed, and maybe I could try to take these different foods and products, and maybe just talk with different doctors about it. And then we move on to magnesiums. Yeah, we keep on, right, Ingrid? Yeah, of course. One of the other big supplements is magnesium. As I did some research before, and it strengthens the bone health of the immune system, also the functions of nerves and muscles, and it helps people to keep concentrated and focused and also to be happier. And it can improve some symptoms of women that are with menopause or premenopause. And there are plenty ways of taking this supplement. Sorry, the light again. Sorry, I'm gonna move. I'll be back in a second. Sorry, I will try to move back more. As I was saying, here you can see a lot of foods that we have in our daily basis. And then magnesium, we have a lot of ways of taking it. We have it on pills and tablets. Um, but I had a little chat with a mate. We can have a spray of magnesiums, and you can put it in the legs, and it is the muscles. And maybe we thought about a lot of reasons, because we have this nervous leg symptom. Magnesium maybe can work. You massage a little bit your legs before you're going to bed. It has very good scents, like lavender or something like that, and it can make easier to sleep for the patient. We just need to look a little bit into it. And for the different solutions, Peter, do you want to say something? I don't know. There are different interactions that we can talk about them later. And normally the supplement doses are very low ones. uh, of the magnesium, I would like to highlight that there are 7 types of magnesiums. It's not the same citrato, bisphorato. There is one of the magnesiums is a laxative, so we need to be careful and check which type of magnesium are we taking. And we can find a lot of information out there about these 7 types of magnesiums. And the best option is to take them in their powder, because everybody is different. Each person tolerates a different quantity or dose of this supplement, and maybe we can just talk with the doctor. And the fact of taking the magnesium in powder, we can balance better the quantity of it that we take. So I talked about it before with my workmate. The Suma, yeah, if you put a little bit on the food and you just give yourself a little massage, and it's a pleasure. Yeah, it's magnificent. I want to ask something. The magnesium spray started on TV in an advert, and I thought at first it was a very good idea, and I had a very specific question for myelofibrosis patients. They normally, because of health reasons, they need to stay for a longer time on bed. And normally they are elderly people, most of them. So they they lose muscle strength. So a lot of times when they take magnesium, the body doesn't accept it. So if we're talking about spray, does it help the patient to regain that strength in the muscles? I'm not sure about it, not that much, because I also wanted to recommend that the magnesiums, we can measure it very well with a blood test. So there are some patients that maybe lose some magnesiums on other types of supplements because they have different kidney problems or something like that. Um, and these types of supplements as sprays, they can help, but not as much than just having the medicine and taking them with pills. And the treatment of this type of salts um, is It's not that common, but it can actually improve the muscle strength in a more topical way. Peter, what you said, for the patients that cannot move properly or they struggle moving, what works better is different techniques as yoga or qigong, very smoothly ones exercises, and it improves the different movements that we can do with our body. Okay, thank you. Now we'll move on to ginger, the famous ginger. Mm, it's one of the best supplements. Well, it's actually a plant that is very common and very used in specific or more traditional medicines and treatments. It's been proven that it relieves the nausea. It has anti-inflammatory properties, and the way you can take it, it's very diverse. You can add it in every type of food, as if you were using any other type of spice. You can apply it for the ginger, but it takes time until we find the ginger that works better for us. Well, in my case, I take it with orange juice because I cannot take it with any other type of food, but it's just my case. But this with the vitamin C, these should be supplements that we need to take from the moment that the summer vacations ends until they start again. When in my case, when I looked online for some research, it's very rare to find an interaction because ginger, you don't usually take it as a medicine, it's just as a supplement, and you're not gonna absorb the same way a pill rather than a powder medicine. But it is true that you can introduce it in different teas or infusions, and I haven't found until for now these interactions. And then we move on also to the turmeric, these famous ones. Well, it's very similar to ginger. It's very common in the Indian culture. They use it a lot to cook. Um, it's been proven that it gives very good results. It's antioxidant, anti-inflammatory properties as well. It improves the immune system. It's an active component with the curcumin. And if you like it, it's a very good as well. The same case as with the ginger. In my case, I do love turmeric and ginger, but it is true that the flavor at first is a little bit tough. Maybe it's better to take it at first just with a supplement on a pill. Well, ginger, you can also take it as we do it with sushi, and there are a lot of people that like it this way. And it can be combined, both of them, turmeric and ginger, they can be combined in multiple ways of to eat it. And well, uh, I also include the reference, even if it's in English. It's a very cool article talking about all the properties that it can have. It improves the blood circulation. Um, the 99.9% of our patients, uh, they have anti-aggregants, syntron, or any kind of anticoagulant. So we need to be very careful not to take supplements in excess. If you take a little bit of ginger in the morning, it's not that you're taking a huge quantity of it, but it is very important to look carefully and measure the amount that we take to check if we have more more problems with the platelets, more problem with our blood. Um, and that's why it's very important to have a nice conversation with our doctor to check that everything is working properly. If we bleed more, to have a follow up in a short term. And also, yeah, these follow ups, they are very important. And in general, all patients that are getting these anticoagulants and all of that, they are very aware that they need to be very careful about any type of bleeding. And whenever they are in their pregnancy era, we need to be very careful. And I always tell patients to be very careful about the supplements that we take. That it's just common sense, but still they are supplements that have been used for a long time now, and they have a lot of benefits. And it is very important to be aware of all of this. And that's the main purpose of today's webinar. Is not a taboo supplements. It is actually recommended, but we need to start with their doses and balancing and seeing which are the different side effects or how the impact that these products have on us.
What I wanted to talk about is omega-3. There's a lot of varieties and information, and also there's a lot of more of research because there's also some cardiovascular benefits. It also reduces blood pressure. They improve cholesterol and thrombosis risk. So, for example, our patients that have thrombosis risk, this can be an important supplement. As we were saying with the previous one, this one has also anticoagulant. Yeah, with syndrome, for example, there is a lot of um, discrepancies. For example, the new blood thinner have less risk. Many patients have syndrome, for example, or other treatments. You have blood tests very often, so you just need to talk about this and to keep paying attention to this data. And you also yourself need to pay attention about your issues. For example, if you have a high INR result, you should take control of it. Or, for example, from omega-3, there's oil fish, for example. Um, there's tablets. You have different kinds, amounts. Are uh, having different kinds of omega-3. Yeah, I'm taking one, for example, 3, 6, 7, and 9, the whole pack. And there's regard, for example, I will also talk about the prevention on cardiovascular diseases. Yeah, in our patients, we need to prevent the high blood pressure, the triglycerides levels of sugar. We need to prevent the thrombosis in this way. We need to be conscious about this both as doctors and patients. And this comes along with a good nutrition, going out for walks. If we are doing something for hyper with high blood pressure and then we're staying at home, it's not really helping so much. And this one, for example, I'm sorry, this one is in English, but I thought it was a very beautiful graphic. It's an optimized treatment with different integrated areas. So, and this is just about what we have been talking about. So physical activity, mental activity, yoga, meditation, doing whatever you think is meditation for you. For example, for you can be writing or drawing mandalas, other kinds of therapies such as acupuncture, massages. Everybody loves going to spas, so you can just go. From the part of nutrition and supplements is what we have been talking about. So all of this together comes along with managing MPNs, as we already know. It's all on whole pack. So yeah, I saw this one. I thought it was the perfect slide. I will use this slide to talk about um, in from Global MPN. We are launching this week, and also from MPN Spain, we have generated a project, a well-being project, in which patients can log themselves into a platform, and there's yoga lessons, qigong, meditation, conscious breathing. We have a new branch mainly so we can work in a holistic basis. There's also psychological support, nutritional support. So this thing is available for patients and relatives, so we can keep pushing forward on these aspects that we truly believe in, both as doctors or me myself, who is daughter of a patient. My father, for example, is always telling me how to breathe, meditate, taking supplements, because we realize these things are important. I wanted to say this now, seeing that this slide is talking about is we have launched this well-being project. And here there's a promotion on all levels, promoting health, advocating for health further away than the traditional thing. If you give me a second, Ingrid, I think that society has changed a lot in this regard. Seeing so many young people and from different backgrounds that are working out, I think it will truly change the future. There's many things that we still need to do, such as research, for example. But if we can actually change some habits, this can change the long-term impact, mainly for the health of the people. So I'm totally for this thing. Yeah, I totally agree with you, because recently we spoke with a very young patient from another country who has been diagnosed with thrombocythemia. She's a teacher, uh, a Pilates instructor, and she cannot live without Pilates. The day she has a pain in her body because of the sickness, she is going for Pilates. That's her sport. And we have another patient from Colombia, is her her safety is found in Qigong, and it is Qigong that is helping her with pain. Other people have yoga, others walking. Everybody finds their own place, the thing that helps their body. But we need to go out and, well, we, for example, have two patients here in Spain and with Qigong, and one of them is asking for more lessons because she says that she has more energy since she does Qigong. So it's going along with the body and helping it, uh, maybe dancing, whatever, but we need to do something. Yeah, of course, physical exercise um, has been proven by different studies that physical exercise can help patients from all pathologies, but mainly MPNs, oncological diseases. Of course, everybody is different, but any exercise can help. I tell sometimes patients, if you just walk, that's enough. Some patients tell me, I've taken the stairs to arrive here to the medical visit, and I feel too tired. I will need a blood transfusion. Some patients say, for example, I try to walk to go to the supermarket, or I try to walk my dog. So yeah, if for example, as you were saying, if for you it's working with Pilates and meditation, that's all right. You need to find what works for you. And I'm very sure that there's a lot of benefits, hormonally speaking, for example, and in other fields. And of course, this has an impact, and it helps also with the mind. And if it helps the mind, it helps the rest of the body. Yeah, this is a kind of butterfly effect. Okay, let me go on. So this is a topic that we talked about with Ingrid, and talking with her, we wanted to talk about iron. Iron is an essential m- medicine, so as to say, for our body. All of our bodies need iron, but MPN patients need to be very careful. For example, PV patients do not need iron. It's uh, not really advised in very limited situations. For example, if they take multivitamins, they shouldn't take iron. Uh, Iron is the main food for red blood cells. So yeah, if uh, if you have PV, you shouldn't take more iron usually. For other patients with myelofibrosis or essential thrombocythemia, we need to take iron when we have actually proven that there's a deficiency. Def Iron deficiency is usually caused by something. Maybe it's because we are not eating what we should need. Maybe for women, it's very common with the period. Maybe because some kind of surgery or because of another illness. There's many illnesses from different kinds that can cause iron deficiencies. So in a patient, which is this one is an extended procedure, if there's an iron deficiency, it has to be researched. So, for example, in in PV, it can also be common, but we need to find out why it is happening, so we know that it's nothing else provoking it. So, for example, if it's some other issues and we find that there's nothing else, that's when we give the supplements. So, in these patients, we need to be very careful. This needs to be taken care of from the by the doctor, either the physician or the hematologist. Food with iron, for example, uh, we have all the ones you see here. Also, meat, for example. Very often we say maybe we shouldn't eat so much meat, but if a patient has iron deficiency, maybe we'll recommend to have more meat. But we need to truly be careful to manage the iron deficiencies. So, for example, patients with myelofibrosis or thrombocythemia with anemia, what's the procedure that you follow in these cases? Because, for example, anemia comes from something. So, okay, let's say that I see a patient with myelofibrosis that starts to have a stronger anemia. So, firstly, what I ask for is the blood test for folic acid, iron, and vitamin B12. So let's say if B12 and folic acid are normal and iron is low, I check colonoscopy and endoscopy. So maybe there's an internal um, a problem. Maybe there's an internal bleeding. So, for example, in our healthcare system, there's um, other kinds of tests on the feces, but usually I just go for endoscopy. So, if everything is negative, maybe we're not having enough iron because our spleen is too big and we're not eating enough. But oral, um, we can give oral iron or directly in blood. In essential thrombocythemia patients, for example, we need to have a more continuous follow-up. But yeah, we need to do research on it. It's not really counter-advised, but we need to research into it. For example, if there's an internal bleeding, even if we give iron, we're not solving anything. So we need to research to see find out if there is another issue. So that's something we need to find out. So, for example, in patients with myelofibrosis, if they have blood transfusions very often, they usually receive iron with these transfusions. So, if this patient, for example, um, is having so many transfusions and a very high level of iron, that's not good. We need a balance. So, when sometimes with patients, we talk with patients, we need to reiterate that we need to take care. So yes, we need to summarize. Taking supplements, okay, not always with iron. If we want to take iron, we need to ask our doctor. In the case there's anemia, a deeper anemia, we need a blood test with B12, folic acid, and iron to see if this iron deficiency comes from that or something else. So yeah, we just need to go to the doctor so the doctor researched about it. Yeah, I was raising my hand as a good student. I was not listening about everything about the fire, about iron, but I have a question. So for example, with each phlebotomy, we lose iron. But yeah, we talked about transfusions, but yeah, that's the issue. In many patients with polycythemia vera, for example, it's us causing the iron deficiency because we're carrying out some phlebotomies. But if a patient with polycythemia vera, I'm taking the blood out, but then I give them iron, there's a vicious circle. So that's why it's counter advised. It's not really advised. So yeah, in polycythemia vera, we do not advise it. Sometimes, for example, with the diet, with the nutritional habits, we can increase it. I can talk about PV for 5 hours, of course, but yeah, with PV, very often you have the tiredness, the fatigue, the tickling. But yeah, the iron deficiency is big, but we cannot give them iron because then there is a vicious circle of needing more phlebotomies. For these patients, I usually recommend to improve their diet. So yeah, for example, in the diet, the recommended dose is 14 milligrams. and the one that we give on our doses, it's 200 milligrams. So there's a big margin. So if you improve a diet just a bit, you can find the balance. For example, maybe I do not have a big deficiency and the big strong symptoms, but also I am not going until the non-control point of polycythemia. This is one of the topics that me, as somebody who is treating polycythemia vera for many years, finding the perfect point is hard. Now imagine that you have a patient that tells you that needs to take iron because it has this deficit, and then this patient sees that has a better quality of life, less mind fog, less fatigue, and all of that. If the patient is being under control of doctors, this can be kept on the long term. I mean, the supplement that you take orally. Yeah. Yes, the supplement, if there's a good control, you can keep doing that, of course. But the treatments, as they are so intense, no, yeah, the treatment I understand. Because with a treatment, you give a very big dose. But when you're taking a supplement because your quality of life is bigger, because some symptoms have improved because of the iron, maybe for that patient, if they are feeling okay, they can keep taking that, right? Maybe the doctor needs to keep controlling it, but yeah, in patients with polycythemia vera, for me, it's a no-go. For the rest of the patients, as doses are very low, supplements and all of that, and very often you just need to play with the diet. Iron from some products um, such as legumes, vegetables, they are having a control over it. For example, vegetarians are really having good levels. This is a hard topic to manage, but there can be other pathologies that can affect the absorption of iron. So, in these cases, such as hematologists, sometimes need to have some help from other specialists, such as gastro and others. But that's the same thing as we've been saying. If a patient acknowledges the problem they have, this is an open conversation we need to have. Yeah, we shouldn't be worried to tell the doctors about it. You can just propose that you want to take it, and the doctor will help you. So yeah, creatine. So when we were talking about supplements, there was a patient that asked me, "What can I do with creatinine?" So yeah, I have the same issue. Somebody's asking me. So for creatinine, it's widely known in the gym world. It really helps the muscle growth and recovery and physical exercise, working out in general. But when I was researching about it, there's also data about it improving bone health. It can also help with the premenstrual tiredness. But as everything, there's good and bad sides on it. There's not a lot of data when I was looking about it. Um, there's not a lot of data about interferences with MPN medicines, but If you have problems on your liver or your kidneys, there can be some complications. So if there's kidney some issues with your kidney, you shouldn't be taking this one. You need to take care. You should be careful with this one. I also usually say with moderation. Sometimes we have patients that are athletes, but we need to take it with moderation. And this one can be taken from the diet, meat, salmon, other products. The products you see here, they can give creatinine. The supplements usually are a powder or in some milkshakes. So, for example, if you go to the gym very often, you see people taking them because it helps, but they need to be taken with moderation. The patients we talk with, they have this, they work out. A patient of mine, for example, she works as firefighter, so she needs it. So what I said was like, okay, let's take it with moderation. Keep going on with your treatment, and I will run a blood test. So yeah, what I don't want it to affect, for example, your MPN treatment that we have already under control. So yeah, she, for example, started taking it not every day, only the days that she had like a bigger fatigue because of um, physical work. Yeah, also, as we were saying before, maybe you can take it yourself and it doesn't work on you, but on other people it works out perfectly. But with moderation, consciousness, and talking with the doctor, it can be all right. For example, if you tell your doctor uh, that you want to take a supplement because it helps you, for doctors, it's much easier because if we see something on the blood test and it doesn't match what we know, it's different. But if the patient says, "Oh, I'm taking this tea or I'm taking this supplement," well, it really helps to know. We need to keep this open communication. Yeah. Also, the daily amount that we take, for example, people with MPNs, if you take something in excess, if you take too much of something, um, it can have a negative effect. For example, having some tea twice a day, it can be okay. But if you take five, it can have some problems in your intestine, and you need to go to the toilet more often than necessary. So for detox diets is another big topic. So yeah, researching about it, there's not really a lot of data, not enough studies. Generally, with MPNs, I do not recommend it. I'm very worried about the interactions with the medicines because these medicines can help clean the liver, but people who take medicines for MPNs, the liver needs to be focused on other stuff. It needs to be focused on the treatment. So it goes into the blood in the appropriate dose. So these detox diets can have strong interactions with these drugs, or they can also affect the liver and the kidneys, for example. So we need to be very careful. Yeah, Ingrid? Yeah, also with detox, you also take some supplements of herbs that are actually interacting with the liver. And the liver in this moment is just thinking about the cytoreductase. So that's why. with detox, sometimes it can help for some things, but for the other part, it's not really helping. Um, we have not talked about intermittent fasting. We do not have enough research. Some studies show that can help because it's like you're not detoxing fully, just a bit. So, in our patients who are taking cytoreductors, it's very hard because many of the drugs that we take need to be taken with some food. So I do not have enough data today. Like as of right now, I don't have enough data. So yeah, this is something we need to take with a pinch of salt. Yeah, of course, eating at 10, 12 at night is not the best thing unless you need to do it because of work. But eating at 9, 10 p.m. until 8 a.m., it's already some hours. If you think about it, sometimes some people are just
There are people that just take a simple coffee and that's it, but each person is a different world. And I added different information here so that we raise awareness about the Mediterranean diet. And my grandpa or grandma, they would say, of course, it's the best diet, but it's been proven scientifically that this type of diet is one of the best ones, the Mediterranean diet. It has variety, fresh foods, green ones. And I added different aspects that we've heard about them a lot of times before, um, the alcohol intakes, eat more times but less quantity. As Peter said, there are patients that are not used to move that much. We need to see our or their intake in comparison with the movement that they do daily, and what that patient might need is to have a good protein intake so that the muscles and the muscle strength is kept as good as possible. And there is the Mediterranean diet for that. Instead of doing just a fried snack, once in a while it's very good, but maybe you can rather take some nuts, which are rich in omega-3, these walnuts, yeah. Um, don't you see that walnuts have this brain side? That's what my grandpa used to tell me, and I do think that we need to make the most out of it, and we need to give us a treat once in a while. How come you're not gonna celebrate a birthday without a cake? Yeah, it is what it is. Or maybe with some chips and olives. We do really need to pay attention to the diets and these different supplements that we may take, but we also need to have fun. Yeah, yeah, we're missing the interactions. We've talked about a lot of them. I didn't highlight the inf herbal tea or infusion of San Juan. It's one of the most effective ones. I didn't know much about it before I started to study medicine, but it is actually a herb that's very used, very common, and we need to be very careful about it. There are other types of herbs, the mint, puleo. It's not chamomile. I wanted to say the chamomile tea, they do not create as many interactions. But it is true that what we talked about the detox diets and other types of herbs, tea, or infusions, if someone wants to lose weight, we really need to check this with interaction with these herbs. May affect our liver. We need to stop the cytoreductive medication, and it's very important to talk about it with our doctor or the professional worker that has given them to us. And I have two or different curiosities here. The interactions with ruxolitinib. One of them is with this fruit called the grapefruit, uh, and apparently the che- chemical function that they do in the liver. And with the Sevilla oranges, it's the same. It has wrong interactions. Both the grapefruits and the Sevilla's oranges, they do different chemical um, interaction inside our liver, and they are very yummy, but we need to take that in mind and be careful about it. I used to think about it with Ingrid. Sometimes they take this. People might just get a spoon and eat a lot of jam or jelly. But it is true that it's better just take a few uh, spoons rather than the whole jar. But I do recall it every time because there are people that actually do this, eating the whole jar. And it is true also that with the IDRIA, other type of treatments, they do have other interactions, but with the food things, they don't have as many. But if we move on to the medicines, that's a completely whole different story. There are a lot of people that take anticoagulants, and there is a syndrome list and different medicines that it's impressive. The diets as well, even the green vegetables, they can interact. Spinach, for example, this is the most common one. So it's very important what we're talking about today. We really need to pay attention to it, talk about it with with our doctor. And they are the ones that know more about this topic. So they are just gonna try to help. Um, I'm gonna come back to the first slide. Each person is a different world, and maybe something it's good for us and it's not good for another person. They are just supplements, and we need to be aware and know what we want to supplement and what are the benefits of how they can balance and ease my symptoms so that we can improve our quality of life. Yeah, you're right. We can take supplements, but just we need to tell our doctors as well. Maybe take some tests before we do it. Maybe we need vitamin B12 to handle and manage better the fatigue and tiredness and all of that, so that we can improve our general organism. I'm gonna stop sharing the screen with you. I'm not in a hurry. We can still talk about it during 10 minutes, but we have personal questions, but we cannot talk about it now because we need to study a little bit more about it, and we'll answer them later. Now we can talk about general topics. There are different patients that are sending us messages from Latin America. They are commenting that yes, yoga, meditation to balance the ginger. They are talking about nutritional aspects. Also, they've been talking about a lot of the things that we've mentioned today, and it is very important to go not only to the hematologist but also to the nutritionist. And they they can all give a hand. And I want to talk about something else now that we are in the MPN day. I like to talk about three different topics: the importance of physical exercise and doing sports. And we do know that's very important to do some exercise, no matter if it's just go for a walk, doing yoga, no matter what, we need to find our way to do some exercise. And we need to jump that barrier. Okay, we are tired, but after this tiredness, we're gonna be better and get better. Uh, we just need to take it one day at a time, and we'll improve little by little. We also have the importance of the skincare. We not we need to take some sun, have some sun on us, but with the sunscreen, that's crucial. Even if we are in the winter season, there are a lot of campaigns, marketing campaigns, but most of the products that are on the market dealing with the face, they include the sunscreen. And in winter, the part of our body that's most exposed is the face. And we can use different fashion products and outfits such as these caps, and the most important thing is just to protect our skin. I'm joking, but I'm taking this seriously as well. The skin cancer is one of the most common cancers within the general population. In the UK, for example, the number of this type of cancer has increased notably, and we need to prevent so that we can try our best not to have it. Perfect. Yeah. Last but not least, but we have not covered today, which is you when you have new patients, they arrive with that enormous shock because they've just been diagnosed with a cancer, with a word that they've never heard about it before. They do some research online, and the information that they find, it's very dramatic. So how do you handle this with your patients? What do you do? How do you help them? Which is the psychological aspect of this. And the first thing that we try is to um, the the adjunct, or more like a senior man or woman. The first thing is to try to have as much time as possible during all these sessions. If you have this new patient, you are gonna have as much time as possible with that patient, because once you've got diagnosed with cancer, it's very difficult to process it. A lot of times you just diagnose them and you just tell them that you're gonna run some blood tests and you're gonna take them just with aspirin, and they just feel that okay, this is a chronic thing, but you're gonna treat me. So how is that possible? There are some different cancers where people are treated with different surgeries and things like that, or even chemo. But in this case, it's just we tell them it's just about a chronic disease. We're just gonna give you um, uh, aspirin, but if you have a PV, or it depends on the type of MPN that you have, you may have some blood tests or just stay with the aspirin. So we need to take time with them and explain them very clearly from the start. This is a chronic cancer. We're gonna treat it this way. You have these different options, and we also tell them that's very important to have an eye of the cholesterol, the sugar, the need of doing exercise. What are the different needs that you have? Because every patient is a different world, and it's not the same to talk or speak with a young person that wants to create a family rather than talk with a more elderly person, or an adult one that's working and that may think that it's going to affect their work or job. So normally in our clinic, we do have a specialist nurse that helps us a lot with these logistics aspects, with dealing with the job, medical aid, economic and financial aid. So she's charged of helping the patients. So it's very important um, that we stay as a team. So the new patient is just a new member of the team. Um, you have here this nurse. We also have a specialist pharmacist um, with whom I normally talk about these things. So doing this, we support the patient. We also have physiotherapy people helping us that just follow up patients with chronic fatigue. Um, so we have these logistics around the patient that's key to them. We also have these psychologists members, and they normally try to help us as much as possible, but they do have a lot of work as well, so it's more difficult. But if we consider that the patient needs to go to the psychologist, we try as hard as possible so that they make it. And we just offer them time and availability. We try to have it as much as possible. We're not perfect, that's of course. The first question that I ask to my patients is, what do you understand from what you've been said and told? From that point, we manage how are we going to address and talk with the patient. Once you finish the first doctor's consult, so you just need to write down all the questions that you have, and next time that we're gonna see each other, um, we are just gonna go over all the questions, answering them, because there are some questions that patient may think, how I'm gonna ask this, but we tell them you just need to ask them, because what you're wondering, maybe 100 more patients have asked about it, or maybe none of them, but you as a patient need to ask questions. And if your doctor, well, I also understand that each situation is different and every doctor is also a different world, and it can be difficult at some point, but it is very important that you have all your questions written down, that you ask questions, because you may be wondering, can I take a flight? There are some places that can, there are other that don't. Or maybe, could I take this supplement, vitamin supplement? Maybe yes, maybe not. But you'll never know if you don't ask. We need to be aware that it's just you, the one that's suffering. So you need to take care of you, and you need to write down all the things that you're wondering and asking yourself. And that's what I think it's the most important thing. It's not difficult to give time to them. No, because I do really think that patients need them at that point when they've just been diagnosed. And I do tell all the patients that I took more time with a specific patients because they've just been diagnosed and they do understand it normally. And I always try that the patient leaves the room uh, understanding everything that's going on, what's gonna be about them in the future, what's the process. And we ask them to stay to play with us in some kind of way. And we explain that they are not alone in this process, and there is a team behind them, and it just don't apply to the patient but also to the family. We'll talk about family matters, which are the silence sufferers. They also struggle a lot because they want to do something and they can't. They suffer a lot. They feel guilty because they cannot help more, and it's also complex. Um, it goes beyond the myeloproliferative problems that you want to do more, but you cannot. There is also the psychological charge. There are also patients that don't share their feelings, and but well, it just depends on the patient. What shocks me as well is the variations within the different countries. For example, we have the Latin American, where there are more and more cases of MPN, and their situation is that they do not have medications. The doctors don't know about the disease, whereas here in Spain, it depends on the doctor that you go to. Uh, there are some doctors that they don't make an effort to understand them. They don't empathize, but there are others that they do. I always tell my patients, is this is what I do. Um, and I work with it because I do know what I'm talking about. Maybe if you ask me about the latest news about other types of disease, I may need to check it and do some research because you don't have deep knowledge. But I'm very lucky to be in a hospital where we do have this capacity. I share my consults and my doctor's checks with over 10 members, and it's not the same. I come from being a doctor in Spain with 25 patients and just go one after another one. And here I can be with just a patient during a whole hour. So this is what makes the real difference. And it can also apply to northern European countries, and also in China, for example, it's completely different as well. So it depends, and it's very difficult. But it is true um, that there is more and more general aspects in the hematology perspective. Uh, and it also depends on the time that you can be with the patient, and it depends on the patient, the doctor, the time, availability, and everything. Maybe you can empathize better with a patient rather than with another one. It just depends. As a summary, we can say that if you're a patient, you just need to ask. Don't feel ashamed of asking, because maybe it's the first time they've been asked this question, or maybe it's the 100 one, but it is important to ask. And also, it is also very important to receive information in these webinars. Maybe we can ask Peter as well. Of 20 years ago, we had no information at all, which is very important as well. Is that you need to search and look for information in the correct sources. Maybe Global MPN Scientific Foundation, the UK companies. It's not the same to look for information in general Google rather than in a specific scientific